All right, everybody, welcome into chapter 4. Um, Today we're going to talk about really getting into the meat of now I've determined that there's an emergency or that something is wrong. Now what am I going to do? And there's a lot that goes into this, but we'll just go over the basics. So first we're going to look at what an assessment is and how we assess somebody. That is really putting a name to what we do when we look at somebody that may be in trouble. Okay, it's a sequence of actions that helps determine what is wrong. All right, so now let's get into the steps of an assessment. So the first thing you're going to do when you start assessing the situation is you're going to size up the scene. You're going to then do a primary assessment. You're going to obtain a sample history. Then you'll perform a secondary assessment, and then you'll reassess. Okay. Here's a quick flow chart of how you do that. Just as kind of an overview. Flow charts are really nice for studying. I would suggest it to you guys as a study tool, especially when it comes to chapter 5 and getting ready for the practical exam. All right, so when we're trying to size up the scene, what this means is we're trying to look at the situation as a whole and make sure that it is safe for us to approach and act. So we're going to look for hazards. Is there something that's a part of that situation that can harm me as a first aid provider? Because if we go in gung-ho and just dive right in without assessing any of this, and then we get harmed, we get hurt, we may create a second emergency, and we're not helping anybody if we do that. Okay? Be aware of the potential for violence. If it was a violent sort of accident, like a stabbing or a shooting or something like that, is there a potential for more violence? Do you see any weapons, knives, guns, those sorts of things? If it is hazardous, don't go in to the scene. Call 911. Let the proper authorities handle it. Okay, protect yourself first. You're no good to the person that is experiencing the emergency if you are also hurt, right? If the scene does appear to be, if there are chemicals or things that could further the harm to the person that's experiencing the emergency, we want to reduce their exposure to that. For example, if there's a chemical spill, if there's electricity in the area that's causing electrocution, those types of things, we could turn off the electricity. We could grab the chemical container and move it away, or possibly move the person from the thing that is causing them harm. Okay? Next, we're going to determine whether we're going to perform a primary assessment. So the parts of a primary assessment are these. We need to determine whether the problem is an injury or an illness. Was this an accident, or does this person just suddenly become ill? Okay. Are there any life-threatening conditions? Is there something that I need to address right away to save this person's life, right? Maybe it's not the source of the problem, but it's something that I need to address to keep them alive. Things like, are they responsive? Are they breathing? Do they have circulation? Or are they getting blood flow all throughout their body? Or do they have severe bleeding? Okay, those are some things that could be life-threatening that I need to address right away because the timing is very important. All right. Part of our primary assessment really is just getting a first impression of what is going on. We have to decide, is there going to be a chance I could be exposed to blood or body fluids, right? Is there a danger to me or those around the emergency? Is it an injury or an illness? Are they responsive, unresponsive? Are they adequately breathing? Are they talking to me? Are they bleeding? Those are just some questions you'll ask yourself. All right. Now, when checking responsiveness, um, just to kind of give you an introduction, we have to decide um, a couple of different things. First of all, I need to find out, are they awake or are they not awake? If they're awake, can they talk to me? Can they not talk to me? If they can talk to me, I'm going to introduce myself, kind of ask if I can help them, maybe explain what I'm planning on doing. And during that process, we're also trying to evaluate, can they remember anything? Do they understand what I'm telling them? Or is there some sort of a delay mentally on that's going on there? That is part of the responsiveness process. Now, we'll dive a little bit more into this um, when we talk about head injuries and those types of things. But gauging their level of responsiveness can kind of help us understand, well, is this a neurological issue? Is there something that is causing them to lose consciousness? All right, so next we're going to assess their breathing. We have to decide, are they breathing or not? Is their breathing normal? Is it abnormal? Does it sound weird? Are they having to work hard to breathe? Those types of things. So a couple of different ways we can evaluate that is by checking their chest movement. Is their chest rising and falling? Does it look like it is requiring a lot of effort to accomplish that or not? Um, when they're breathing, does it sound normal? Does it sound like a normal breath sound, or does it sound different? These are just some examples of some abnormal breath sounds here in this table. Are they snoring? Are they gurgling? Are they crowing? Excuse me. Are they wheezing? Snoring is exactly what it sounds like. Snoring, like you hear in the movies, those types of things. All snoring is really, even in a normal person, is their airway is partially blocked, and that can be for one reason or another. Okay, if there's gurgling, that usually means that there's fluids in their throat or in their airway. Maybe they were drowning for a moment. Maybe they are bleeding into their airway. Those types of things. If there's a noisy creak or a squeak, there could be some sort of a spasm of their air in their airway. That could be with an allergic reaction. That could be with something like that. And then wheezing is if there's partial obstruction, like asthma, emphysema, those types of things. All right. Next, we're going to check for severe bleeding. Um, we want to look for blood anywhere. Is it on their clothing? Is it on the ground around them? Um, and then we're going to try and find the source of the bleeding. That may mean we need to expose the wound with some scissors, and we'll kind of talk about that a little bit later as well. And then we need to control the bleeding with direct pressure. And we have an entire chapter on bleeding where we'll talk more about that. But direct pressure is how we control bleeding. If we have access to gloves, we want to use those to prevent the spread of bloodborne pathogens. Um, just know that cloth and extra dressings don't necessarily protect against bloodborne pathogens. If the blood can reach you, then you can be exposed to a bloodborne pathogen. Okay, it's not like clothing acts as a filter. Okay, after we've looked at those things, now we need to position the person. Okay, we need to decide if it is safe to move them or not. Now, for the most part, you should not move a victim unless it is absolutely necessary. For example, if they are in further danger, meaning there's like chemicals around them that are burning them, they're in a building that is no longer safe, there's an active shooter around, things like that. But we really shouldn't move them unless we need to. Especially because anytime there's any sort of unconsciousness, we're going to assume that they have a neck injury. Okay? Anytime there is lack of responsiveness or they are unconscious or have a head injury, we are going to assume they have a neck injury. Now, that is a quiz question. Make sure that you understand that. Okay? Um, If you are confident they don't have a neck injury, if you saw what happened, then you can move them. Again, some of those other exceptions. I mean, if they're going to die in the place that they're at, if a neck injury becomes worse because we move them, well, at least they are still alive. Okay. If the person is face down and needs CPR, then we're going to have to move them to perform that. If they cannot breathe because there's vomit in their airway, we have to get that vomit out. So we have to turn them to their side so they can evacuate the vomit. If you have to leave to get help, you may need to position them in a safer location. Or if there's signs of shock, then we may need to move them as well. Okay, so that's our primary assessment. Now we're moving on to our sample history. Okay, this is where we go into a little bit of a deeper dive. We're not quite as worried about life-threatening stuff right now. Now we're trying to look into some of the deeper issues that may be causing their symptoms. Okay, so sample stands for symptoms, allergies, medications, pertinent past medical history, last food or drink, and then events leading up to the injury or illness. Okay. Now what the information we can come to learn is going to change based on the responsiveness of the patient. If they can talk to you, then we're probably going to be able to get most of this information. If they can't talk to you, you're not going to get much of it, right? You're going to be able to figure out what you can and then move on. Okay. So symptoms are things that the patient can only feel. So pain, nausea, dizziness, those are things that you can't necessarily see on the person, right? They have to tell you that they're experiencing these things. Once we've learned their symptoms, then we go to allergies. Do you have any allergies? Or are you allergic to anything? Next, medications. Are you taking any medications that you shouldn't be taking? Or have you missed a medication that you should be taking? Those sorts of things. Then we're going to talk about past medical history, especially, has this happened to you before? Do you know somebody that this has happened to, especially in your family? Are you seeing a doctor for this condition? Those types of things. There's lots of different things that are just not pertinent that we don't need to ask. Your favorite color is probably not pertinent to why you're feeling super nauseous on the ground, right? Those types of things. What you last ate or drank. This is a question I ask a lot as an athletic trainer, right? An athlete will come up to me and they're nauseous, they're not feeling good, and I'm like, well, when was the last time you ate something? Most of the time, it's, I haven't eaten in quite a while. Well, that will make you nauseous and feel like garbage. So that is a very important question. And then the events leading up to the illness or injury. What happened? Okay, that's kind of the meat of what's going on, and it's going to tell us a lot. All right, another part of the medical history that can be really helpful. There are certain conditions where people will wear a medical identification tag. Things like diabetes, things like heart disease, epilepsy, those types of things. They may wear a medical tag that shows that. Okay. Now, again, this one doesn't really tell us much, but they may have a bracelet or a necklace or a card that says type 1 diabetic or epileptic. Those types of things where we can say, oh, we know what's going on, most likely. Let's get them the help they need because this is above my pay grade, those types of things. Okay. All right, so after we've completed our sample history, now we're going to do our secondary assessment. Now, this is even more than the history. Like, we've really ruled out there's no emergency. Let's figure out what is the cause of going on, and it's just a deeper dive, right? This is not something where I have to do something right now or you're going to die most of the time, okay? Again, if there are any life-threatening problems, you treat all of those before you go to a secondary assessment, okay? Now that we're in our secondary assessment, we're going to determine more of the cause of the injury, especially if we can figure out if it was significant. Like I mentioned earlier, anybody with a head injury, we're also going to assume they have a spinal injury, so we're going to be very careful about moving that victim. All right, Now we're going to assess the person's body, okay? Now this is a quiz question, so make sure you understand the difference between signs and symptoms. Now I talked earlier about symptoms. Symptoms describe things that only the victim can feel. Nausea, dizziness, pain, okay? Signs are things that we can see. Things like swelling, things like bruising, things like deformity. Those are signs, okay? The easiest way to find these types of things is to compare bilaterally, especially on the extremities, right? You have two hands, two arms, two legs. If we can look at one leg compared to the other, then it's a lot easier to see, oh, his knee is super swollen, because look at his other one. It is way bigger than his other one, okay? So that is a quiz question, signs and symptoms. Make sure you understand that. All right. This is also a quiz question. Make sure you understand what DOTS stands for, the acronym DOTS, okay? When doing our physical exam, this is our guide. These are the things we're looking for. We're looking for deformity, open wounds, tenderness, and swelling, okay? Deformity, meaning look at this elbow. This is a dislocated elbow because your normal elbow does not look like that, okay? Open wounds, that's an open wound. It's an open cut, okay? And on the next slide, tenderness, right? We can kind of palpate, feel around the area where their pain is at and find out where the tenderness is at, or if there's tenderness present. And then swelling, right? We compare this ankle to this ankle. This ankle is definitely more swollen or larger than this one, which means there's swelling present, okay? All right, now that we've performed our head to toe physical exam, right, we've kind of looked around, made sure that we notice anything that could be injured or have a problem so that we know how to fix it, or we can at least take steps to fix it. During our head to toe physical exam, they may or may not be responsive, right? Depending on our primary assessment, we may determine that we just need to call 911. There's not really much that we can do, but we can still assess them head to toe to see if there's other injuries we need to take care of. Okay, again, it's repeated so many times because it's really important. Anytime there's somebody is unresponsive, okay, and they have MOI, stands for mechanism of injury, meaning something happened that would lead you to think they may have a spinal injury, okay, they may have a head injury, we have to assume that they have a spinal injury, okay, because if we move somebody with a spinal injury, we could sever their spinal cord, and that could kill them, A, or B, could paralyze them for the rest of their life. So that is very important that we be careful with that. Okay. Again, when we're checking the person, we're looking for either an injury or a sudden illness. If there's a life-threatening condition found at any point in your assessment, no matter what steps you're at in the process, stop and treat it before you keep going, okay? Then, once we've done our primary assessment, our sample history, our secondary assessment, treated everything that we can, then we're going to reassess, meaning we regularly check up on the person, talk to them. How are you feeling? Are you starting to feel worse? Do we need to try something different? Okay. And really important, just be calm throughout this whole process. I know it can be difficult because it's very high stress. There's a lot of things going on. But if you take your time, talk to the person, have a normal conversation, if you are calm, that will really help this process go a lot easier. All right. Some special things you may need to consider when we're doing our assessment. If we need to expose the injury, okay, we may have to cut or remove some clothing to be able to see the injury, to be able to best see how we can treat it, okay? Again, we talked about being careful with contact, using our PPE and those types of things to help protect ourselves when doing the assessment may be important, okay? Not only from, diseases, COVID-19 and those types of things, but also we just live in a world where it's really difficult, and you can be accused of touching somebody inappropriately or those types of things. So using PPE can really help protect you from that as well. And then again, we talked a little bit about dots. Just keep that at the forefront of your mind. Some optional things you can check for, especially if after your assessments you really are not finding the source of the issue, doing some really deep dive stuff like checking heart rate can be important. Okay. On an adult, a regular heart rate at rest is between 60 and 100 beats per minute. Depending on what source you look to, some say 90. That's kind of what I always learned, but really under 100 is pretty normal at rest. Okay, so I showed you guys in that video the assignment how to check a pulse. Refer to that if you have any questions. But that it can be helpful in your assessment to find out what's wrong. We could also take a look at their breathing rate. If they're breathing faster than normal, that may be an indication of respiratory distress. A rate less than 8 or greater than 24 meets those benchmarks of being abnormal. Now I know like it says between 12 and 20 breaths per minute for an adult is what's normal, but being off by 1 or 2 breaths per minute is probably not that serious. That's why it gives us a benchmark of less than 8 or greater than 24. Okay? Some other things we can look at: skin condition, the temperature, the color, the moisture may teach us a few different things. The color of your skin, like if it's blue, if it's really red. Blue may leads us to believe a lack of oxygen, whereas redness leads us to believe some sort of inflammation. Okay, moisture could be sweat, could be um, temperature, those types of things are what we may look at. Okay. We may also check their eyes, compare the pupils. Pupil dilation, meaning this middle picture, your pupils get really large, can happen within 30 to 60 seconds of cardiac arrest. So if somebody's starting to show signs and symptoms of cardiac arrest and you also see that, there's a good chance that their heart is stopped. Okay. Also, if their pupils are 2 different sizes, like this last picture, if they're unequal, that could be a sign of some really bad neurological conditions. So that may be something that we look at as well. Okay. Last but not least, we can also do a capillary refill test to check for blood flow, whether an extremity is getting blood flow or not, or whether the heart is pumping blood really to the body in general. To do that, you press on either the fingernail or the pad of the finger, whichever hand you're worried about. And what it will do is, normally our skin is nice and pink, right? When you press on it, it'll go white, and then when you let go, it'll go right back pink. It takes longer than about a second or two. That usually means that the refill or the blood flow to that extremity or location in the body is compromised in some way, and so we may need to look into that a little bit further. All right, so that's chapter 4. Just kind of a quick overview of some things we would be looking for in an assessment. If you have any questions, please reach out. And yeah, have a good one, guys.